An older person can seem completely normal in the morning, then by late afternoon become weak, dizzy, unusually sleepy, or mentally not quite there. Family members may immediately fear dementia or a stroke. Sometimes the change follows a hot day, a stomach illness, several days of poor appetite, or simply not drinking enough. Dehydration can be an overlooked contributor, especially after 60, but there is an important safety rule from the beginning. New sudden confusion should never be treated at home as just dehydration. It can have many urgent causes and needs medical assessment. The reason dehydration becomes easier to develop with age is not simply that older people forget to drink. The body's thirst signal may become less noticeable. A younger person may feel strongly thirsty early enough to respond. An older adult may not receive the same warning until fluid intake has already fallen. There are also practical barriers. A person may avoid drinks because getting to the bathroom is difficult. They may worry about leakage, nighttime urination, or falling on the way to the toilet. Pain, weakness, poor vision, or reduced mobility may make it harder to reach the kitchen or carry a glass safely. Someone with memory problems may leave a drink untouched because they forget it is there. Swallowing problems, mouth pain, nausea, or difficulty holding a cup can reduce intake even further. Medications can also matter. Diuretics increase urine output and may raise the risk of dehydration, especially during hot weather or acute illness. Other medicines may contribute indirectly through dry mouth, nausea, diarrhea, sweating, sedation, or reduced awareness. That does not mean anyone should skip, stop, or move a prescribed medicine on their own. It means that a full medication review can be important when weakness, dizziness, or mental changes appear. The body depends on fluid balance for circulation, blood pressure, kidney function, temperature control, and electrolyte balance. When fluid volume falls, a person may feel tired, weak, or lightheaded. Standing up may cause dizziness because blood pressure drops. Reduced stability and slower reactions can increase the risk of a fall. The brain can also be affected. Dehydration may contribute to reduced attention, slower thinking, irritability, and mental fog. More serious dehydration, especially when electrolyte levels are disturbed, can contribute to delirium. Delirium is an acute change in attention, awareness, or thinking. The person may become unusually sleepy, agitated, disoriented, or unable to follow a simple conversation. The evidence needs careful wording. Research in adults over 60 suggests that dehydration is associated with poorer health outcomes and may affect cognitive performance. But the evidence on cognition is limited and inconsistent. That means it would be wrong to say that every episode of forgetfulness is caused by low water intake, or that drinking more water reverses memory loss. The safer and more accurate message is that dehydration is one potentially reversible contributor that should be considered as part of the full picture. So what signs might suggest that fluid intake has fallen? The earliest clues may be easy to miss. Thirst can occur, but thirst alone is not reliable after 60. The mouth may feel dry or sticky, urine may become darker, and the person may urinate less often or in smaller amounts. They may complain of headache, fatigue, dizziness, reduced stamina, muscle cramps, or weakness. These signs are useful clues, but none of them proves dehydration by itself. Dark urine can also be affected by foods, vitamins, supplements, or medicines. Dry mouth can come from medication effects or mouth breathing. Dizziness may be caused by low blood pressure, heart problems, bleeding, infection, or medication changes. A person can also be dehydrated without feeling very thirsty. This is why the pattern matters more than one isolated sign. Ask whether the person has been drinking less than usual. Are full cups being left untouched? Has the weather been unusually hot? Was there fever, vomiting, diarrhea, or reduced appetite? Did a new medication begin recently? Is the person getting dizzy when standing? Are they urinating less? Can they swallow safely and keep fluids down? A short record can help. Note approximate fluid intake, urination, illness symptoms, heat exposure, dizziness, unusual sleepiness, and any change in thinking. This does not diagnose dehydration, but it gives a clinician a clearer picture. One of the most common mistakes is to assume that sudden confusion in an older adult is normal aging. It is not. A person with delirium may suddenly not know where they are. They may struggle to answer simple questions, become unusually drowsy, speak incoherently, see things that are not present, or behave very differently from normal. Dehydration and electrolyte imbalance can trigger or worsen delirium, especially in a vulnerable older adult. But the same sudden change can also be caused by infection, stroke, low blood sugar, low oxygen, medication toxicity, withdrawal, seizures, or head injury. That is why the response should not be, give them water and wait. The person should not be left alone, and urgent medical help is appropriate for a new, sudden change in mental status. Other warning signs also need prompt attention: fainting, severe weakness, very little or no urine, rapid breathing, rapid heartbeat, increasing sleepiness, difficulty waking, inability to keep fluids down, or signs of heat stroke. If a person has new facial drooping, one-sided weakness, trouble speaking, chest pain, severe breathing difficulty, or loss of consciousness, emergency care is needed. Several situations raise the risk of dehydration after 60. Hot weather is one of the most important. Older adults may not notice heat stress early, and the body may not adjust as efficiently. Weakness, nausea, dizziness, poor coordination, confusion, fainting, a rapid pulse, or very high body temperature can indicate heat illness. Vomiting and diarrhea can cause rapid losses of both fluid and electrolytes. The risk increases when the person cannot keep drinks down. Fever and infection create another dangerous combination. Illness can reduce appetite and thirst while increasing fluid loss. Infection itself can also cause delirium, so confusion during an illness should never automatically be blamed on dehydration. Diabetes can contribute when high blood glucose causes frequent urination and fluid loss. People with dementia or other cognitive impairment may forget to drink, fail to recognize thirst, or be unable to explain that they feel unwell. Continence concerns are another overlooked cause. Some older adults deliberately drink less because they fear leakage or repeated bathroom trips. That can create a cycle in which avoiding fluids leads to weakness, dizziness, and even greater difficulty reaching the bathroom safely. Reduced mobility has a similar effect. A drink may be only a few meters away, but pain, fear of falling, or dependence on another person can make it effectively inaccessible. Alcohol can add to the problem by affecting judgment and contributing to fluid loss, especially during heat or illness. Prevention does not need to be complicated, but it should be practical. Keep drinks visible and within easy reach. Offer fluids regularly instead of waiting for the person to ask. Pair drinking with routines that already happen, such as meals, medication times, television breaks, or phone calls. Use preferred beverages when medically appropriate. Water is useful, but soups, milk, fruit, and other foods also contribute to total water intake. During hot weather, fever, vomiting, diarrhea, or poor appetite, pay closer attention than usual. Check on older relatives who live alone. Make bathroom access safer rather than solving the problem by restricting fluids. Nightlights, clear walking paths, grab bars, and suitable continence support may reduce the fear that leads someone to avoid drinking. Swallowing difficulty, repeated nighttime urination, or persistent incontinence should be discussed with a clinician. Those problems may be treatable, and ignoring them can make hydration harder. There is no single fluid target that is correct for everyone. General references sometimes estimate total daily water intake at roughly 2.7 litres for women and 3.7 litres for men, but those amounts include water from both food and beverages. They are not a universal drinking prescription. Needs differ according to body size, activity, climate, medications, kidney function, heart function, and illness. Some people with heart failure, advanced kidney disease, low blood sodium, or another medical condition may have a prescribed fluid limit. They should follow their clinician's plan, not generic internet advice. It is also important not to rely on popular home tests as though they were definitive. Skin pinching, urine colour, and dry mouth are not reliable enough on their own to confirm or rule out dehydration in an older person. A proper evaluation may include blood pressure, pulse, clinical examination, kidney tests, electrolyte tests, urine testing, and a search for the underlying cause. The most useful message is not simply drink more water. It is to notice when normal intake has changed, understand which situations increase risk, and recognize when the symptoms are too serious to watch at home. Dehydration can be a potentially reversible contributor to weakness, dizziness, fatigue, and confusion. But it is not an explanation for every memory complaint, and it should never be used to dismiss sudden mental changes. After 60, the first warning may not be thirst. It may be the untouched glass, the darker urine, the dizziness on standing, the sudden loss of energy, or the feeling that the person is mentally different from usual. Notice those changes early. Make fluids easy to reach. Pay extra attention during heat and illness. Review medications with a clinician when risk changes. And when confusion appears suddenly, treat it as a medical warning sign, not as normal aging, and not as something to solve by simply offering water and waiting.